Dr. Tim Juelson here at the Bone and Joint Center with Dalton Feeney, somebody that you may know. And we are trying to reach out to parents, coaches, athletes in an attempt to help minimize risk of injury, especially for overhead throwing athletes. And the other folks at risk, tennis players, volleyball players, but in this case, we're really trying to focus on pitchers. And so the main thing we use to help minimize that risk is a pitch count, and you may be familiar with that already. So in looking at the pitch count and then some days of rest afterwards, usually is a fairly effective way to minimize risk to the shoulder and elbow. So Dalton, can you tell us a little bit about what happened leading up to your elbow injury?
Like you said, pitch count is very important, and leading up to my injury, I sat out all Century baseball season and came into the Summer Legion, and my coaches were great on giving me days of rest, pitch count, just trying to ease into it. But one weekend I got invited to a showcase down in Kansas City, and I threw high volume. Pitch count was probably 25 to 35 pitches, and just trying to impress the scouts and just kind of throw my hardest. And after that day, I had a little bit of elbow problems, a little soreness that wasn't always the same as it used to be. But then we had the State Legion tournament probably 4 days after, and I usually had a week rest of pitching in between games, a week rest of doing that, and I only had about 4 days of rest. And through the State Legion tournament, first inning, just trying to throw my regular fastball and felt something in my elbow, and ever since that day I went to the doctor. You helped me out. I found out it was just a partial tear in the UCL, and that's what really caught my eye as a pitcher, and wondering where my future was going to go with pitching. And now I'm so cautious. I mean, every week I get a week rest. I do a certain routine of conditioning, long toss, and I really watch my pitches. I mean, for Century Baseball, I was a pitcher and a shortstop, so if I pitched on a Friday, Monday, Tuesday, I'd just be doing long toss and taking ground balls but not throwing. So I think I've been as careful as I've ever been with this injury, and if I had to give any key things to any athletes out there that are pitchers or fielders, you really have to take care of your arm. I mean, being a baseball player and having that injury, I always look back, what could I have done different, but I can't do that, so I'm here to help out other athletes, and you have to speak up. I mean, coaches don't know how your arm's feeling, and you're the only one that knows it, so you got to tell them how your arm's feeling, if it's sore or anything, and maybe you can just take ground balls, maybe you can take just pop flies and not throw. And I mean, some days you're going to have to skip days to pitch if it's only a 4-day rest. I mean, you really have to take care of your arm.
That's great, Dalton. Certainly it's important to keep in mind that we want to keep people healthy long term, and getting a few extra pitches in here and there or an extra game in, the key is to think about long term. And we know fairly well that pitch count and innings pitched directly relates to risk of injury for both the throwing shoulder and elbow. Is there anything else that you'd like to add?
No, just like I said, I mean, once you really get injured in that situation, you really look back and wish you would have done something different and did your regular routine with the week rest. And I just want to tell athletes, if your arm's sore or anything, high pitch count, high innings and weeks is not very good as a pitcher, and you really need to take care of it, because, I mean, you can go a long way with this arm in baseball. So,
well, thank you, and best of luck with your career. I hope everything continues well for you.
Appreciate it.